Welcome, welcome, Wamkilikile, qualifiers, family and friends, staff and guests. The procession may be seated. Congratulations on getting to this point of qualifying. After years of hard work and dedication, acquiring knowledge and developing skills and competencies as a healthcare professional. We welcome you today to this most auspicious event of commitment to a profession, to a life of service with humility and integrity. This is not a graduation. And so we just remind you that we call you qualifiers, we call you graduands, not yet graduates. Graduates come as a celebration when the university pulls together a congregation that is called together by the Chancellor. Once that congregation is together, they're allowed to confer degrees, and after that, you are called a graduate. Today, though, it doesn't take away any of that. Today is less about the celebration of how far you've come, which indeed it is. But it is also, more importantly, which graduations don't do, forward-looking, focus on the life that you are to lead as professionals. We're unique at the Health Sciences faculty that we have these degree programs that qualify you as health professionals, that we then have these ceremonies where we commit ourselves to a life of service. And so that's what we're here today, is to make that commitment. And so we ask you to be present in yourselves, to not think about yesterday and tomorrow and just now, but to think about what's happening right now in this space. And to just get a sense of the gravitas of the occasion, that this is really important. Our Dean, Professor Lionel Green-Thompson, is not able to be with us today because he is at the installation of the Chancellor of the university, and he's been asked to participate in the proceedings there. But he's nevertheless with us today in video. And so I'm Dr. Karen Begg. I'm the undergraduate Deputy Dean for the faculty, and my colleagues here, as you can see, I have Dr. Tracy Naledi, the Deputy Dean of Health Services, as well as a number of honored guests that I will introduce a little later. So we're going to hear now from the Dean as to what the importance is of this oath-taking, so that you can start to prepare your minds before we start to take the oath. Thank you.
Welcome to this oath-taking ceremony. Every time we take an oath or make a declaration, we're telling the story of the promises that we make. And if one looks through history, you see that oaths themselves have emerged at different times of our history as health professionals to help us come back to the straight and narrow, so to speak. And today is no different. You're being invited to make an oath, to make a promise to the people who surround you. And for me, it's quite a powerful occasion that in fact you are here with guests that you have invited. So each of those guests represent millions of people outside of this room, in the country, in a country which is often suffering great hardship, and to whom you will come to give them some kind of solution to their problems. So as you take the oath today, be mindful of a couple of things. Mindful of this idea of promise, that every time we make a promise, it doesn't mean that we never fail at fulfilling the promise, but every time we make a promise, we're suggesting that we can do something to make tomorrow better for everybody. And that's what this oath is about, is that even as you go into your internships, your community service years, in very difficult times as a result of the pandemic, you too make a promise. And the promise is simple. The promise is that every time you engage with a patient, you value them in that particular interaction. You treat them with the sense of love and respect. And you recognize their vulnerability in the moment in which you engage with them. The oath will invite you to comment on and make a promise to ethical behavior, professional conduct, and lifelong learning. These are the things I wish for you, because often the systems in which you will work will challenge those very values. But the idea of lifelong learning has become such an essential part of our response to the pandemic that for you it's going to be part of your daily life. For you, you're going to have to make decisions, remake them, and change them repeatedly as you begin to work in a complex environment. Don't be afraid of changing your mind. That's the nature of a self-transformative self. You're able to look at the facts that you're presented with, engage with the conflicts that arise as a result of your patients having a different worldview to you. Increasingly in our world, the exclusion and marginalization of transgender people become a very real challenge to your practice of healthcare. Make sure that nobody feels left on the margins of society after they've engaged with you. That's what this promise today is about. And that's why we take a decision to gather you here. One, because an oath only has meaning because it is made in the company of others. And two, that there are representatives in that community that gathers of people outside of the profession. This is what this oath taking is all about. And I do wish you well as you take your oath, and that each day you may get up afresh, promising to do better that day, or to keep your end of the bargain. I wish you well and safety as you travel on your professional journey.
So if qualifiers, you stay seated. But the guests who've come with you, won't you please stand for a moment? So there's a reason that you are all here today. And there's a reason that we were particularly wanted guests to be with our qualifiers. First of all, to witness, because we can't make a promise without saying it in front of witnesses. And so, qualifiers, you are committing the oath today in front of your family, your guests, as witnesses. But secondly, if you can all just look around at who's here today, representing the complete variation and diversity of our country and beyond our borders of our country, that these are the kinds of people that you are going to be serving, that your parents, your guests, your special family members who are here with you today are representing the community to whom you are making a commitment today. So just hold that in that moment. Thank you so much. You may all be seated. So as you ready your minds to take this important step of becoming colleagues, health professionals, we're going to listen to a few of our leading alumni and community members as to how they advise you to consider in preparation for taking the oath. So we'll now hear from those colleagues. Thank you.
So I remember when I took my oath, I was overwhelmed with a feeling of relief and accomplishment and pride. And the words made perfect sense, but it's only with experience that the words actually take some meaning and really come to life.
As you are taking this oath today, remember, oath is about empathy, professionalism, and care. If you've got those three, you are a winner. Also, oath is about humanity, responsibility of both provider and receiver.
On reflection, the very first line stands out to me, which is I pledge to serve. And so we always need to remember that we are in service of people not of ourselves, not of money, not of status or societal stereotypes. And we need to serve with integrity and humility.
I really think it's important to actually reflect on the privilege that it is to be a health professional. So many people are trying to apply to get into one of the disciplines at UCT, and for me, you know, it's a massive privilege to actually be sitting here today, or for me to have earned my degree as a physiotherapist. And I think we always have to remember that it's a privilege to actually be helping someone through a really difficult time, that it involves one of the most important aspects of their life, their health.
One of the commitments that you'll make is that of lifelong learning. The commitment to lifelong learning means using the current period that we're going through as an example, is that you see that there's a rapid change in new knowledge, new diseases, and new health challenges. And as a health professional, you must always be at the forefront of research, information, new technology, to be able to respond appropriately.
Newcomer into the health system, you may often feel that you can't change much. As a group of interns, we were able to notice that one of our wards in a rural hospital really needed touch-ups. It was a children's ward that was quite plain, but we worked together with local businesses, with colleagues, to ensure that we transformed it into a child-friendly ward. This does illustrate that coming with new eyes, you would and are able to change things for the better within the health system.
Working with an underprivileged team and providing the coaches with skills or the athletes with skills to enhance their abilities is amazing. And I think that's the important thing within South Africa, is that yes, we might not have the resources, for every team might not be equal and every hospital might not be equal, but we have so much skill and knowledge as health professionals that it's so easy to actually teach another person.
As a health professional in South Africa, and given the inequalities in our societies, I think it's particularly important for health professionals to be mindful of those inequalities, to do their bits in terms of addressing those inequalities. And that will require us working not only across our disciplines in the health professions, but with other sectors, working intersectorally to make sure that we address the challenges of our societies in a comprehensive manner.
So the oath has guided my daily practice, and I noticed this in my second month of internship when one of the matrons came to me and asked which university do I come from. So I thought I did something wrong and said UCT. But what transpired actually has stuck with me for many months. So she noticed that there was something different in the way in which I interacted with the nurses, the porters, the patient, and she really wanted to compliment that. That was surprising because I thought I was doing what you should be doing, but she had noticed that as something extraordinary. So many of you will get into the service and think you're doing the normal, but that turns out to be the extraordinary because of the type of education you've received and the type of training that you've received.
And one needs to embrace the good times, but learn from the difficult times, and also look after yourselves amidst all of that, and recognize that you have immense power as a healthcare professional to be a voice for your patients, to uphold their human rights, to serve them, and as cliched as it may sound, to make the world a better place.
It is very important that the student must reflect on their work that they are doing within our communities, especially the marginalized community and vulnerable one. We need to hear the voices of our gogos, meaning our elderly people who are always standing in those queues at the clinic. We need to hear the voices of our own sisters who are domestic violence abuse. Go out there and be advocates for a change.
My message to students is to always remember what a resilient group they are. They are the group that saw the Fees Must Fall movement. They have just survived a pandemic. These are graduates who are going to be able to change the face of South Africa, the face of the health system in the country. And I think whenever it gets tough, every single graduate should remember that they have gone through the most and they will still survive.
I really do feel that these challenges have made the class more resilient, more mature and more capable. And I really look forward to this new generation of more socially responsive and compassionate healthcare professionals.
To you, I say that you've conquered, you've made it this far, and I know that South Africa is going to be a better place because of you. Go well and make us proud.
Congratulations on a remarkable achievement under extremely difficult circumstances. I have true confidence that you will be fantastic healthcare professionals for the communities that you work for. I wish you every joy and success as you embark on this noble and rewarding profession. Much love. God bless.
I would like to congratulate you for a journey well traveled. You have really surmounted many challenges, and we look forward to welcoming you into the health system.
A good luck for your future, and be the lamp wherever you go. Shine. Sithi isiXhosa, ndingantaka baba uvula amaphiko uwatweze, meaning fly eagle, fly higher and spread the wings. All the best to you. Halala, enkosi.
Thank you, Chief.
Ainchis, it means good day. Tawedes, greetings. Ayesa means blessings. Hey. People, I must once again state this university, the University of Cape Town, I would call the University of Cape. There's the ancient name for Cape Town, which means place where the clouds gather. It is sacred. This is the most sacred mountain. So this foundation of this institution in this most sacred mountain. Remember, education first and foremost, it's a spiritual endeavor because it leads to serving community, serving humanity. Never ever forget that. You are a human being, a spiritual being. You must serve, and you must do that from the spirit first and foremost. The mind and the heart will always be there. Like there will be food and water. but the sacredness of the spirit, the breath. We have a concept which is called atuatama kamski. Atuatama kamski. It means the sacred breath, and it's aligned to the birth of a baby. And the most authentic sacred moment is the first breath that the baby takes. Afterwards, as we are sitting here, it's involuntary because of the Great Spirit Creator's wisdom. Otherwise, some of us might forget to breathe. So every time you breathe in and you breathe out, it's the sacred moment of Atuatama Kamski. And we tend to forget this in a busy world, in an educated world, in a materialized world. So we need to come back to our spirit, our fountain, our foundation, as human beings, not just human beings, from the Great Spirit Creator and the creation. Let me say again, our relationship, our relational existence, fourfold, is the thou, the Great Spirit Creator, is the I, is the other, and the rest of creation. Kaya, amase. This is sacred. This relationship is sacred. It may not be broken, otherwise become lost. And it happens within a circle. Therefore, our relationship with the Great Spirit Creator is a circle. With each other is a circle. This is why light and the fire is so important. It forces us to be in a circle. So as we go forth, let's be mindful of our created spirituality, our common humanity. And when we look at one another, we act with one another. Let us be kind. Let us be gracious. Let us be humble. Mother Teresa, she said, you cannot humiliate a humble person. It is so true. It is what it is. You cannot humiliate a humble person. So let us stay anchored. That is the anchor. We have forgotten it. Let us go back to reflect so that every action be the action of reflection. It is what it is what we are, who we are intrinsically. It cannot be extricated. It's interlinked. We are made for one another. Community, communal, it's sacred. We are sacred beings. We must never ever forget it. Kaya, Gangans. Kaisa Gangans. Kaisa Gangans. Kai Gangans means thank you. Kai Gangans, thank you so very much. But Kaisa Gangans means it's a deep appreciation, so deep it cannot be expressed. And so you become quiet because the deepest form of communication, silence, solitude, reflection.
Thank you so much to Chief Mackey and Headman Damons for just reminding us of our humanity, first and foremost. So colleagues, we now are about to take the pledge, take the oath. Importantly, this year, the oath that started many centuries ago was the Hippocratic Oath that many of you will be familiar with. It's not quite as relevant and understandable as in these current times. And so over time, it was modified to the Geneva Declaration, and at UCT, we've modified it further to have a specific UCT oath declaration. Today, however, you will be saying for the first time an oath that has been further adjusted. Since the recent launch of the Code Red for Humanity on climate change, and the WHO COP26 Special Report on Climate Change and Health, the UCT Faculty of Health Sciences have now approved that the oath will now reflect a commitment to health of the environment for the first time. So you are breaking ground today. Can I ask the qualifiers to please stand? Procession stand. I'm going to ask any qualifiers who are on their own to please, so in other words, they don't have a family member or a guest with them. This is really important that we do this in a collegial way and that we do this together. So any qualifiers on your own, we'd like one of the party on the stage will come and join you. Will you just indicate? We've got one down here. Thank you. Any others who are standing on your own? Where's the other one? Okay. Thank you. So, colleagues, I'd like you to take a moment to ready yourself for this important commitment as you're about to pledge before witnesses. Academics and your teachers, represented here today, will join you in committing ourselves to the oath as we welcome you to the profession as colleagues. This is the watershed moment that you transition from students to colleagues. Chief Mackey and Headman Damons are standing as representatives of the community to which you will be committing this oath and pledge as you take it now. I will be reading out each sentence, after which each of you will repeat after me. The first statement, after the I, you will indicate your name, because a promise is not a promise unless it's a personal commitment. So please don't repeat my name when you say it. Put your own name in. All right. I, Karen Begg, solemnly pledge to serve humanity. My most important considerations will be the health of patients, the health of their communities, and the health of the environment. I will not permit considerations of age, gender, race, religion, ethnic origin, sexual orientation, disease, disability, or any other factor to adversely affect the care I give to patients. I will uphold human rights and civil liberties to advance health, even under threat. I will uphold human rights and civil liberties to advance health, even under threat. I will engage patients and colleagues as partners in healthcare. I will engage patients and colleagues as partners in healthcare. I will practice my profession with conscience and dignity. I will respect the confidentiality of patients, present or past, living or deceased. I will respect the confidentiality of patients, present or past, living or deceased. I will value research and will be guided in its conduct by the highest ethical standards. I will value research and will be guided in its conduct by the highest ethical standards. I commit myself to lifelong learning. I make these promises solemnly, freely, and upon my honor. I make these promises solemnly, freely, and upon my honor. Welcome, colleagues. And now, as the commitment to carry this through into the rest of your professional life, please be seated and sign the oath before your witnesses. We gave you a pen to make sure that you'd be able to do so. Please sign the oath in front of your witnesses. Thanks. We look forward to working with you as colleagues, and welcome and well done. We really do wish to thank you all for attending. This has been a tricky time for us, and we've been watching the COVID numbers with great trepidation and praying that the numbers would remain low, that we could proceed with these celebrations. And so we would ask, as newly qualified professionals and newly committed professionals, that you will be the role models that you have just committed to, that you will advocate for preventative measures, for vaccination, for making sure that we do everything in our power to reduce the risk of transmission of COVID. And so we ask that you be considerate of that as you leave today on the stairs, taking photographs, as you leave and celebrate, that you're just conscious of the fact that we are immensely privileged and honored to have still had this ceremony in person in spite of being in the middle of a pandemic. And so we ask that when you are outside, that you remain physically distanced, that you keep your masks on. You may briefly take them off for photographs and put them straight back on again. But to please be cognizant of the fact that we have done this in a time of pandemic. So colleagues, I really would like to thank, for those of you who it may appear that this all just comes together, there's a huge amount of work and organization that goes into this. We were able to have this within the time that residences are still open, which is today, because of the incredible work that the teachers and academic staff have been able to do to get results finalized. So you sit here today because of the hard work in going through validating all of your results so that there is integrity in you sitting here today as a qualifier. So we've been through around 1,500 students over the last few days, their entire academic record. So if you've been here for longer than 6 years, then we've been through that. Every single course times every single student. And so the same team that was preparing all of those results were also organizing these events. So we do apologize for the minor glitch in gown collection, but we think that that really was really minor in the bigger scheme of things, that we can be here today. So can we just give them a huge round of applause? And please don't forget to return your gowns. And so, colleagues, we are so grateful to have got to this point. And we wish you well in your internships and beyond through community service. We ask that your families continue to support you through a couple of tough years ahead still as you start to serve the community. Take care of yourselves, as we have been reminded by both the Dean as well as Chief Mackey. Self-care is important for you to be able to care for your patients. And so now in final words, we wish you strength and courage as you forge the path ahead. May you listen with compassion, walk with humility, and act with justice. The party will now be leaving the stage to some music. We ask you please to remain seated until the ushers usher you out in a physically distanced way. All right. Hearty congratulations. I'm sure that we can do a huge round of applause and celebration. Well done, class of 2021. We're going to ask Sky and her colleagues to come in and to play us out. Thank you, Sky and the colleagues.